Thank you for joining us today for the Community Crisis Response Rapid Improvement Public Report Out. This process started in 2020 as a collaboration between Contra Costa Health Services, the Mayor's Conference, the Public Managers Association, which is a group of city managers from throughout the county, and many community-based organizations and service providers across our county. As a first step, we completed a value stream mapping event in November that helped us identify 4 areas for further study. This rapid improvement event is the first step in further researching those recommendations. Today, we're going to hear from 2 of our city sponsors, hear a report from the rapid improvement team, which is a video that lasts about a half an hour or so. And then we will invite our director of behavioral health to talk a little bit about how this effort supports the work happening there. The partnership between health services and the Public Managers Association has been vital to our process. Normally, we would start with comments from Contra Costa Health Services Director Anna Roth, but she sends her sincere apologies as she's not feeling well today, so we wish her the best. We are, though, pleased to have City Manager of San Pablo, Matt Rodriguez. Please help me welcome Matt to say a few words.
Thank you, Kim. Welcome and thank you for joining us this afternoon. My name is Matt Rodriguez and I serve as the City Manager for the City of San Pablo. I'm one of 6 fortunate city managers from the cities of Concord, Lafayette, Pittsburgh, San Pablo, San Ramon, and Walnut Creek who are representing the Contra Costa Public Managers Association. Our city manager group has been intimately involved in direct collaboration and partnership with leadership from Contra Costa County Health Services in creating a new regional countywide community response model to address mental health crisis. Since September 2020, prompted by the Contra Costa Mayor's Conference, our ongoing collaboration with our partners on this very important journey has resulted in substantial progress in being made on developing an effective and sustainable new regional response model to meet the increasing demands of critical mental health needs for those individuals suffering in our communities. Unfortunately, as many of us know, many of our law enforcement partnership agencies desperately need our help. With future available and necessary resources in addressing this critical mental health need, with a future 24/7 direct access to regional mental health response in the communities they serve for anyone, anytime, anywhere. Over the last 6 months, a number of city staff representatives, mental health providers, Contra Costa County behavioral staff, and community organizations who specialize in mental health service delivery have been working collaboratively together as part of a design team to develop the nuts and bolts of this new important community-wide regional response model. In November 2020, a successful value stream mapping event was completed, which identified key areas of focus for continued study. And to date, we are very proud of their work, and they continue to make great strides this past week during our first ever Rapid Improvement event, which is one of 3 RIE events being scheduled into this process over the next 2 months. This week's accomplishments from the RIE event focused on the ongoing development of key recommendations to our new model. This includes progress on one-point entry, development of a single phone number for mental health crisis triage, and non-police 24/7 mobile crisis team response. We are very encouraged by this important work being completed to date, and there is no question that substantial more work is needed on this process, and that our design team partners and all stakeholders involved understand the sense of urgency and the demands from our communities in developing a new regional response model that is consistent, available 24/7, and is sustainable over time. But we all cannot do this important work alone, and it will not be completed overnight. It will take considerable time to develop this model appropriately for it to become systematically effective countywide. So I want to commend all the members of our design team and all of our collaborative partners who have committed to this important work and all who are continuing their efforts for all of our communities they serve countywide. Therefore, on behalf of my fellow city managers involved in the Contra Costa PMA, we reaffirm our commitment and pledge our ongoing support to this important work being conducted for this process. In closing, of significant importance is the ongoing partnership between Contra Costa health officials and Contra Costa County public managers, which up to this point has been extremely valuable and vital to our continued success. Thank you.
Thank you, Matt. You're absolutely right. The partnership is incredibly important. We also have with us today Garrett Evans, who is the city manager of Pittsburgh. Garrett, can I turn it over to you?
Thank you, Kim. And want to thank you for allowing me to speak, and thank you, Matt, for your great comments. I do want to thank everyone who has been a part of this rapid improvement event over the last week and really has implemented such an amazing amount of progress and collaboration, working together on all facets on how to deliver this vital program or process in the county. Been impressed with the dedication and commitment to make a better community. Something that I'd like to focus on is the resources that we're pulling all together to give families and individuals in crisis moments. How do we take this and make sure the resources are available before incidents happen, or there are resources available beyond when something happens? So that way law enforcement doesn't always have to be involved. There are so many other alternatives and ways we can work together, and really do appreciate the design team where you have over 24 participants here working very, very hard and dedicated on making this such a better process. And when you think about when we started just 6 months ago, it was sort of anyone, anywhere, anytime, a phased implementation. How do we scale up? This is something that this entire group is looking at, how to make this a reality. The single phone number, mobile 24/7 response, a non-police mobile crisis team, measurable outcomes. This has been an extremely well-focused group that has turned around a product here, and it is continuing to improve through the rapid improvement events. So again, just want to thank everyone who's been a part of this, and let you know, or if communities that want to know more, things are happening. You're going to see a dramatic program coming forward. And it isn't about being first with a program. I really think this is creating one that is viable and meets the needs of the community long term. And I really see that happening with this group of fantastic people on the design team. As Matt said, we'll be back looking at this again, how to improve in April and May. And I want to thank, again, the county, the cities, and everyone on this design team for all their great work. Back to you, Kim.
I'll say again that the partnership really makes all the difference in our ability to move forward on this work. So thank you both for representing the cities in this work. I appreciate that very much. Now, without any further delay, the video is about 28 minutes long or so, and we will see you on the...
And welcome to the Contra Costa Rapid Improvement Event Report Out. I'm Dennis Dees, an improvement advisor for the project, and we would like to share with you this afternoon where we've been, where we would like to go, and some recommendations for your approval. Thank you, and I'll turn it over to Gigi.
I'm Gigi Crowder, and I'm the Executive Director of National Alliance of Mental Illness here in Contra Costa County. On June 2nd, 2019, I was successful in getting my son to PES because he was having a difficult time. I was familiar with the services here in this county, so I didn't have to rely on calling law enforcement this time. This effort is in place to make sure that all in Contra Costa County are able to use a non-police response approach at some point. Our aim is that anyone in Contra Costa County can access timely and appropriate behavioral health crisis service anywhere and anytime.
Hi, my name is Hillary Bowers. I'm the Core Homeless Outreach Coordinator with Health, Housing, and Homeless Services. And this is our current state map. During the Value Stream event in November, we were able to map out our current behavioral health system as care. And various colors, as you can see, represent different parts of our system. During the Value Stream event, we were able to identify the different waste in the system. That could mean time that someone has spent waiting, or things, tasks that take longer than somebody else felt that they should have.
Hi, my name is Chad Pierce with West County Child and Adolescent Services. As a result of the Value Stream mapping event, we determined that we needed to focus on 4 priority improvement areas. 1, a single phone number. 2, a 24/7 mobile response. 3, a non-police mobile response. And finally, 4, alternative destinations. Our main strategy was to use a plan, do, study, act model. The plan is where we plan out the test or observation. The do is when we try out the test on a small scale. The study is when we analyze the data. And the do is when we make adjustments based on what we learn from the test, and then we repeat the cycle, and that's the PDSA cycle.
Hi, my name is Aisha Banks. I'm the improvement advisor also for this project. So just to tell you a little bit about our teams, we have 3 teams that are divided up to do this work. One being our single phone number, mobile 24/7 crisis response team. Our second team is crisis triage and assessment team. Our third team is non-police mobile crisis team. And we had several guest speakers throughout the week, also that helped to support to do this work.
Hi, my name is Kanisha Johnson with Behavioral Health and a team lead during this event. This week, our team worked toward trying to figure out how to have a single phone number and a mobile 24/7 response.
Hi, I'm Jennifer Tuipolotu, Behavioral Health Services, Office for Consumer Empowerment. While diving deep into our work, we realized that there were over 19 plus numbers linked to crisis support services that we gathered in our community. In response, we worked on a goal so that 75% of individuals who call for a mental health crisis will have 24/7 access and a mobile response within 45 minutes. And being that I believe in nothing about us without us, we also checked in with the community to see what they had to say about crisis services in Contra Costa County. Here's an example. I would like a direct line for a dispatcher so that a mobile response could be contacted directly. Also, more mobile response so that they're not flying from San Pablo all the way to Discovery Bay.
Hi, I'm Sandra Wahali with Health, Housing, and Homeless Services. We did a chest of change with our group around the problem the community doesn't know who to call first for a mental health crisis other than 911. We asked residents who they would call during a mental health crisis. Of the 34 people asked, 12% would call family member, 33% did not know who to call, 18% would call their medical doctor, 3% would call the suicide hotline, 9 would call 211, and 25% would call 911. Approximately 75% of those polled were not aware of the available community resources. We determined that community outreach is needed to market who to call besides 911. We had several community perspectives offered to us. The first was from a medical assistant. I'd call 911 because it's the only number I know. I don't know any of those numbers. I would probably suffer in silence. Banker. I don't know who to call, not 911, because it's not life or death. Executive assistant.
My name is Gerald Lörnecker with Contra Costa Children's Mental Health. In order to examine our current problem of uncoordinated entry points for crisis support, we interviewed our current 2 existing call centers and our 2 mobile response teams, and came to the conclusion that a centralized hub would be more effective for a crisis mobile response. I would like the county to let people know that help exists and they can call other numbers beside the suicide hotline or 911, a teenage student reported.
Hi, I'm Dr. Peter Benson with Contra Costa County Fire. During our outreach, we listened to those in our community. Many shared stories of their struggles with their own or a loved one's mental health. A common refrain that we heard was that they were challenged by limited access to a mental health professional, particularly after hours. This centralized crisis call center hub, which we're planning, will address many of these concerns.
Hello, I'm Scott Wanamaker with Contra Costa County Fire. We would like to create a centralized 24/7 call center, similar to what law enforcement and fire department currently use. This call center would be called the hub, where all crisis calls are routed, triaged, and then if needed, a mobile crisis team would be dispatched from the field.
Hi, I'm Matt Millman, a sergeant with Concord Police Department. In this hub, we identified during our testing that the following technology would be necessary to operate. First, an advanced call center software called Vesta from Motorola, for example. It would have functionality like caller ID and text, GPS, and real-time client updates that are sent directly to a mobile data terminal inside crisis team vehicles for updates. It would also include computer-aided dispatch, which would dispatch calls directly to the crisis team for immediate response. It would allow for real-time updates and safety monitoring, and it would optimize response from the time of call to post-crisis follow-up.
Hi, this is Melissa Nino. I'm from Contra Costa Health Services, and now we're leading into some of the work the crisis triage and assessment team did. So we began with a problem statement. Mental health crisis calls aren't consistently responded to with a mental health crisis team. Too often, it's just the police. Some of the goals we created was to develop 2 triage tools and a decision tree that can provide the most appropriate level of care in a timely fashion to anyone, anywhere, and anytime.
Hello, my name is Barbara Serwin, and I'm with the Contra Costa County Mental Health Commission. I'd like to share with you some lived experience perspectives. In February 2021, the Martinez police brought my son, who was threatening another with a knife, into psychiatric emergency. Law enforcement must spend as many hours training how to save the life of a person whose mental state is impaired as they do apprehending a person robbing a bank. Here's another perspective. Our son's first involuntary hold was a suicide by cop type event. He was 16. I have had to call the police over 50 times in the past 19 years in order to get him medical care. He was 5150'd every time, which is not easy. That usually meant that we were living on the edge in fear of what he would do to himself or someone else. We knew that if we called too soon, he wouldn't be taken into the hospital. So we waited, and when the time was right, my husband would stand watch while I snuck into the back room and dialed 911 and said, "Please hurry." We have had to watch our son walk out of our front door in handcuffs to the waiting ambulance too many times. It's the same door that I carried him through as a baby. This illness and system were not included in the dreams for our newborn son and our family. But now that they are our reality, I have committed to partnering with anyone to fix what I call the system of luck and heroics. All of us in this room are part of that system, and we need to join our voices and start shattering silence about the chaos of care.
Hello, my name is Debbie Thomas. I'm a licensed clinician with Forensic Mental Health and Behavioral Health Services. As we all know, when you dial 911, you will get dispatch for law enforcement or emergency medical services or fire. Now is the time to elevate mental health as the 4th arm to bring crisis services to our community.
My name is Beth Hernandez with Contra Costa Health Services. Our team began our work talking to dispatchers across Contra Costa, seeing how mental health triage teams might be sent out to the field. In the worst case scenario, when somebody called 911 with a mental health crisis, the police would be sent out and there would not be a triage team sent out. In the best case scenario, it took a very long time for that triage team to be identified, with the dispatch having to get approval through supervisors. The dispatchers made it clear that what they wanted was clear criteria so they could easily identify mental health crises and send out a team if needed. In our ideal state, when a person calls in crisis, they may have a way to call through a direct line to get to that hub immediately. If that person did call 911, we would like dispatch to be able to identify that crisis and connect them to that centralized hub to dispatch a mental health team immediately.
Hi, my name is Steve Hahn-Smith. I'm with Contra Costa Health Services, Behavioral Health Division. Based on interview data and other sources, we came up with a short set of critical questions as part of the triage screening. As it stands, calls to 911 involve a law enforcement response, and secondarily, there might be a request for mobile response if certain conditions are met, including weapons, presence of weapons, medical issues, violence at the moment, credible threats, and importantly, whether there's a mental health issue. Could also be a substance use issue, but based on interviews, such a distinction typically aren't made at the time. That would be calls from 911. We also get calls that would be routed to the mobile crisis teams. That's the next slide, please. That would be routed to the mobile health crisis teams through 211, 988, the access line, or other non-911 numbers. A similar set of questions would be asked as part of the triage process for these calls, those 5 questions mentioned before, and MC mobile response would respond. If needed, then mobile response could engage law enforcement or EMS for backup or overall coordination. An important note is that even though this triaging process appears to be kind of an on-off switch, it's actually more of a degrees of involvement and timing issues with respect to who would be most involved, who might hold back, who might go first, things like that.
Hi, I'm Steve Blum. I'm clinical supervisor in Contra Costa Health, Housing, and Homeless Services. And the problem we wanted to explore was how to ensure that mental health would be identified in calls to 911. So to test that, we presented multiple mental health crisis scenarios to a sergeant with the Concord Police Department. The results were in a little over half of those calls, a mental health crisis team would not have been deployed along with the police.
My name is Barbara Serwin, and I'm with the Mental Health Commission. I'm going to speak to the goals of the Mobile Crisis Response Team assessment tool that the Triage assessment team created. We developed 2 triage decision trees, one for calls to 911 and one for calls to the Mobile Crisis Response Team. Our goal for the decision trees was to create a tool that would be inclusive of the majority of crisis and non-crisis scenarios, include a non-police response option whenever appropriate, be efficient, and would allow for various levels of care, such as mobile crisis line support, and referral to other resources. We also developed a script to guide a mobile crisis response team clinician or social worker through an assessment of a caller situation. Our goal for the assessment script was to create one that would be efficient, comprehensive, as brief as possible, compassionate and respectful, and culturally sensitive.
So my name is Sue. I'm a licensed clinical social worker working for mobile crisis response team. So I will explain more about triage decision tree test. We have learned community expect reducing significant load of law enforcement in mental health crisis response crisis. But the current issue is that the current decision tree is not inclusive of all potential crisis scenarios. So we will test out the new decision tree. So we tested the current decision tree and asked for the feedback on how we can include the critical elements that would make it more inclusive. So the result is revise the decision tree to make it more inclusive of all crisis scenarios.
Hello, my name is Casey Coble from Contra Costa County Transition Team. I'm a mental health clinical specialist, and I was part of the non-police mobile crisis team. In certain situations, a non-police presence can create an open-minded and empowering experience. For a consumer, having choices can create a space where they can feel more in control of their own interventions, which can make a difference in continued care services.
I'm Captain Denton Carlson with the San Ramon Police Department. In our county, receiving a consistent, quality, non-police response to a mental health emergency can be challenging. There are incredible people doing fantastic work, but depending on the time of day, client knowledge of resources, and the availability of trained personnel, finding and receiving the appropriate resources can be a significant struggle for those who need assistance. What we want to accomplish is this. When mental health emergencies occur, our goal is to provide the least restrictive and most appropriate response within 45 minutes of receiving the call. For now, this approach will be focused on the current expanded business hours with an included goal of 100% follow-up for these interactions by the end of 2021.
Perspective. We spoke with families and consumers and received some perspectives from their experience. Oftentimes, they do not know who else to call besides 911. People call 911 because it's the only option or because it's a fast response.
Hello, my name is Bradley Lindblom, a lieutenant with the San Pablo Police Department.
One of the questions that we studied was how to reduce police involvement with the mobile crisis response team. The problem that we identified is that police presence can escalate or traumatize customers who are seeking help for a mental crisis, as well as the delayed response time of the mobile crisis team. Our test of change that we developed was how can we move away from a police-only response or a co-response to a mental health first model when the situation is safe to do so. Research shows using a mental health first model has been tested and can work. We will continue to test this idea in Contra Costa County moving forward. A quote we received during our testing period was from a family in Concord. I had a fear of calling 911 with my son being African American and being restrained in the past. However, here with the Concord Police and the Mobile Crisis Response Team, we had a positive experience and we will call again.
Hi, my name is Tamara Diaz. I'm a case manager for Contra Costa Youth Continuum of Services. In our discussions about how we were going to help with the time lapse, we discovered that the response times can be too long. It's hard to share resources that way and securely connect with customers. So we decided to ask customers if they had an interest in a virtual connection. This would also improve our wait times. As a result, we're still testing. We're going to test the idea in our upcoming events. In the future, I would be open to virtual interactions is the comments that we're getting.
Hi, my name is Manju Matthews with Detention Mental Health. One of the challenges identified is that information and resources are spread out among different agencies, systems, and individuals. We want to remove barriers for individuals accessing timely and appropriate services. Using SAMHSA guidelines as a tool in our process, an outcome that we came to, like many other teams have identified, was that it would be helpful to have someone that the response team could refer to, like a behavioral health operations center. This centralized hub would maintain information for all the available county resources, like if there was a placement availability at a detox center or shelter, or provide transportation as needed. By coordinating services, this could help make the response team more efficient.
Hi, this is Debbie Thomas. The overall recommendations from our team are to first, empower law enforcement dispatch with the ability and the capacity to route calls to a non-police mobile crisis response team. And in doing so, we want to make sure that we also review a subset of law enforcement dispatch calls so we can get a sense of what percentage could deploy to mental health crisis teams. We also want to coordinate a review process that includes law enforcement, behavioral health, emergency medical services, and families for how we're doing this new work and identify ways that we can improve it. And then establish a collaborative crossover training program for mental health, law enforcement, emergency medical services, peers, everyone who's going to be involved in taking those calls and everyone who's going to be involved in responding to that crisis.
Hi, my name is Melaine Venenciano, City of Pittsburgh Community Services Department. With all that we've learned through this design process and with the guidance from the sponsors, we recommend the creation of a 24/7, 365 days centralized crisis hub and the development of 4 crisis teams that are stationed in all 4 regions of the county. We envision a live person picking up the call and having direct access to a mobile response team that can offer the appropriate cultural and linguistic response and be deployed in a timely manner as necessary. We also recommend exploring what a virtual hub may look like. Most importantly, incorporating advanced technology such as the air traffic control system will allow for seamless coordination during a crisis in real time, which can minimize people falling through the cracks.
Hi, I'm Amanda Dold from Contra Costa County Behavioral Health, and I also was one of the team leads during this event. Our first priority is to continue to test our crisis response as we lead up to our next event. We already have great partnerships with San Ramon, San Pablo, Concord, and Antioch Police Departments. We want to create a flexible response structure that includes on-call, 24/7, and virtual responsibility for individuals and families in crisis.
We want the response team to be able to leverage various resources to best meet the individual and family's needs, including having clinicians, peer and family support, police, emergency medical services, substance use counselors, and doctors. We're going to explore various systems and technology platforms to support our response teams. One of the ideas that we're most excited about is to provide virtual support as a response to crisis, and also to provide intermediate virtual support while the response team is en route to help the community member wherever they are. Virtual options are going to help us dramatically cut down on response time. And finally, as we test changes, we want to continue to gather feedback from the community, our law enforcement and behavioral health partners, as well as utilize quality measures for continuous improvement.
Melissa Nino, Contra Costa Health Services. These are some of the data and measures that we used as part of this project. How will we know when we are successful? We will measure our program success based on the coordinated response, reducing the number of mental health detention bookings and police interventions. It will show that when we reduce the 5150s and psychiatric emergencies, and when we link people into behavioral health care, ongoing behavioral health care. This program will save lives.
Hi, I'm Brian Jacobson from the Contra Costa Health Services Business Intelligence Team. From a data perspective, we're going to need to tackle this project from both the technical end as well as an administrative end. We're going to want to document data from the entire continuum of care we provide in these encounters, from the moment the call comes in, to how we triage and assess the call, to how our mobile response team responds to the call, and finally, how we resolve the crisis and follow-up care. To monitor these projects, we're going to need to look at call center log details, the dispatch system history, client demographics, how we actually got responses to the triage and the assessment tool, looking at the travel details for our response team, and then finally, looking at the crisis encounter details, outcomes, and referrals for future care. On the administrative end, there's going to need to be coordination across the county. We're going to want to flag mental health at all points across the continuum, all points between law enforcement and health services. We will need standardized data sources and data governance. If we are going to house a centrally located database, we need to have agreements surrounding metrics and definitions so that we all analyze things the same way. With a centrally located governed database, we can then provide security access to the right people at the right time so that they can access this data and analyze it. Included in that would also be looking at privacy and data sharing laws, and finally, education, so that anyone in the community who needs access to this data can access it timely and accurately.
I'm Matt White with Contra Costa Health Services Office of Informatics and Technology. And each of the teams kind of put together a list of a number of the things that they'd like to measure. And you can take a look at this later. But what I really wanted to just call out is I think more importantly, we need to create a culture of learning and reviewing the data, and even being willing to be vulnerable and look at our mistakes so we can create a culture of learning and get better together. And here's an example of some of the work that we've done to kind of make the work visual as a way to identify where things are working, where they're not working, identify disparities, and help improve the equitable access to mental health care throughout the county. So these are some tools that we can work to develop together, assuming the items that Brian brought up can be brought into being with the systems and data that we're hoping to create with this work.
Hi there. So this is Dennis Dees again. First of all, I would really like to thank this dynamic, wonderful, multi-specialty team that came together and spent so much time doing this particular work, and giving up so much of their personal time to actually come together and create these solutions and recommendations for you. I really would like to just thank our community leaders, and more importantly, our community members for actually partnering with us during this adventure. I also would like to thank our wonderful sponsors, our city managers, our leaders, our behavioral health executives, etc., across the board. And as you can see on this particular slide here, just a fabulous leadership advisory group who keeps us focused as we continue on this particular journey. And last but not least, I really would like to just thank all of our sponsors, city partners, and funders, especially the City of Pittsburgh, San Pablo, San Ramon, Concord, Walnut Creek, Lafayette, Contra Costa Health Services, and also for our funding, Contra Costa Regional Health Foundation. We really just would like to say thank you very much for supporting this effort, and we look forward to your continued support.
I'm a little blown away, I'm gonna say. I'm gonna ask everybody who was a part of the process who's on the call today to please just quickly turn your cameras on so we can see you all. We'll just take a minute and let everybody who was a part of this process show their faces. I think it's an amazing team, and I want you all to have your moment on camera here. Look at all these great people as they pop up. So I think it was mentioned that this is a team of more than 30 people from across the county who came forward and volunteered an entire week to do this work. It's really impressive. We have people from health, people from law enforcement, service providers, community-based organizations, people with lived experiences, really a broad representation of our community who came together to do this work. And I think you can see these faces on the screen today. That such a great team, such a great team. So thank you all very much for that effort. And now I'm going to ask Dr. Tavano, who is our director of Contra Costa Health Services Behavioral Health Team, to say a few words as we finish up.
Hello, everyone. Really good to see all of you. And really want to, again, I know there have been expressions of appreciation. I'd like to also express those as well. Really starting with all the citizens of our county who really raised their voices and said, we need more, we need better, please help. Because without their voices coming up and forward, you know, work doesn't always get done as timely as it should. So really appreciate all of our community members, not only for expressing the need for more and better crisis service, but also talking about the importance of those services being culturally, racially competent and having full linguistic capacity. So when a crisis is occurring, we have people who speak the appropriate language. It's a really complicated set of things that we need to get done together, but we really need to look at it very broadly. And what I would add to that is whatever we continue to build on, that we do it in a very trauma-informed way, because it is very important to acknowledge that people in crisis probably have already experienced some level of trauma in their life already. And we certainly don't want to intervene in a way that's going to add to that trauma. Would also like to express a lot of appreciation to the mayors, city managers, and police chiefs of the 19 cities of our county. Without the collaborative work, we would be very hard pressed to get this good body of thinking moving forward into action. And then, of course, want to thank all of the members of the design team. I know how hard you've all been working, and it is very detailed and very complex work because you're looking at it in the broadest way possible. So thanks to all of you. You know, just a couple of general comments, going back to a comment that City Manager Evans made earlier in today's presentation. In looking at crisis, we really need to look at the whole continuum of crisis care, which really starts pre-crisis, and the importance that all members of our community have access to the behavioral health services they need before they enter a crisis. That's both from the public system for Medi-Cal beneficiaries, but also want to put it out there, so important for people with commercial insurance to also have access to all of those supportive services that they may need so they don't enter crisis. And then a lot of what we're focusing now is how do we intervene in the moment of the crisis? And then how we do that is so absolutely essential. But then if the crisis doesn't resolve in the moment, what are the next steps? What are the next appropriate levels of intervention? Do we have all of those resources in place in our county now? And that we ensure that people receive the ongoing support they need when the crisis of the moment resolves. So this piece is a really big and important piece of this overall continuum that I just wanted to speak to for a few moments. What I would also like to say is this work is so important, and you can tell from the complexity of it that we're not going to achieve this overnight. But at the same time, please know that there are resources available. Just as was talked about, you might have a lot of different phone numbers. You certainly all have 911. If any member of this community is in crisis, please use those existing resources. Don't hesitate, don't pull back. We really want you to get the care that you need when you need it. So reach out while we're working to be better and more. Make use of what we have right now. I would say just since we started talking about this in November when the value stream mapping occurred, just since that time alone, our mobile crisis response team, the countywide program for adults, has seen almost a 20% increase in the number of calls coming into them for crisis services. So I think as we talk about this, we sensitize the community to what's available now. Please make use of what's available now. And please know that we all collectively are going to be working to make it an even better system for every member of our community. So I will stop there and thank you all so much for this really, really important work. And I'm going to hand it back to Kim.
Thank you, Suzanne. Thank you for the work that you and your team do on this project as well. There will be additional work that happens. We're not near done yet. Additional rapid improvement events will come in April and May. We'll have additional report outs like this as the process moves forward. This broadcast will continue to be available. It will show on CCTV in the coming weeks. It's also available on YouTube and on cchealth.org, which is the health department's website, cchealth.org. So if you go there, you'll be able to see all the times when we plan to broadcast it or watch it directly on that website. So I thank you all again for the incredible amount of work that you did on this project and for being here with us today, and wish you all the best. We'll see you in a couple months. Thank you.